So when we see the anatomy of the mastoid process or mastoid antrum, mastoid air cells, the middle ear cavity and the canal for the tensor tympani muscle and eustachian tube, it looks like a pistol. This part is forming the handle, this is the body part, and this part is forming the trigger. This upper part is epitympanic recess and this is the barrel. So when we draw the diagram of a pistol, this is the barrel, this is known as muzzle, and this is the handle. So this part is formed by the mastoid antrum, this is the mastoid aretus to the mastoid antrum, this part is the tympanum, upper part is epitympanic recess, and this is the eustachian tube. So all in all, the anatomical position of these three parts, the mastoid antrum and air cells, the epitympanum, the tympanic cavity proper, and the eustachian tube, are forming a pistol-like structure. So when we talk about the posterior wall, the posterior wall, also known as the mastoid wall, alveoli like mastoid air cells. So this is the aretus to the mastoid antrum, this is the mastoid antrum, and these are the air cells. The air cells and mastoid antrum, what is the normal anatomy of this antrum and these air cells, and what is the normal anatomy of this aretus to the antrum, I will talk in detail in my next lecture. This posterior part or the mastoid wall is related to this antrum. This wall is also related, this wall, the posterior wall, is also related to the fossa incudius. This is also related to this fossa incudius. This fossa accommodates the small or short process of the incus bone. This accommodates the short process of the incus. This fossa is known as fossa incudius. One more part or one more modification of the posterior wall is the pyramid. The junction between its medial wall and the posterior wall. This is the junction between the medial wall and the posterior wall. This junction is having the pyramid. There is a canal. The canal accommodates the stapedius muscle. The lower part of the canal accommodates the stapedius muscle. So the lower part of this canal accommodates the stapedius muscle. This muscle is taking its origin from the walls of this canal and inserted on the posterior part of the neck of the stapes bone. There are two muscles, the tensor tympani and stapedius. Both muscles damp down the intensity of the sound waves and protect the inner ear. So this muscle, the stapedius, is entering in the middle ear cavity, and the upper part is having the canal for the facial nerve. Facial nerve is having complicated course in the medial wall of the tympanum and the posterior wall of the tympanum. The branches like coda tympani is forming the main component of the middle ear cavity. So this part of the pyramid is related to the facial canal, and finally facial nerve after running backward and finally downwards in the posterior wall or the mastoid wall, leaving the skull through the stylomastoid foramen. So in the posterior wall we can see this adductus to the mastoid antrum. This is the mastoid antrum. Adductus. This part is fossa incudius, which accommodates the short process of the incus. The pyramid, which is forming the part of the canal on the junction of the medial and the posterior wall, and this canal lower part accommodates the stapes muscle and upper part accommodates the facial nerve, which is running backward then finally downwards and emerges from the stylomastoid foramen. One more modification in the lateral part of the spinoid is the posterior canaliculus. This is the posterior canaliculus. Have you heard of anterior canaliculus? If there is anterior canaliculus, there should be posterior canaliculus also. So one branch of the facial nerve, or frankly speaking, the branch of nervus intermedius, is entering in this posterior canaliculus or canaliculi and running in the middle ear cavity. So this is the facial nerve and this is the chorda tympani. So there are four modifications in the posterior wall: the aretus, the fossa incudius, the pyramid and the posterior canaliculus. Now, up to now we have seen the roof or tegmental wall, the floor or jugular wall, the mastoid or posterior wall. Now, we will see the very important anterior wall. In this illustration, we can see this wall, the anterior wall. In uppermost part of the anterior wall, there is an opening which leads to a canal known as canal for tensor tympani muscle. The tensor tympani muscle is taking its origin from walls of this canal, from the cartilage part of this eustachian tube and also from the base of the skull. So this is the canal for the tensor tympani muscle. So this is the canal for tensor tympani. This is the other muscle after the stapedius, which are playing key role during production of the sound and damp down the intensity of sound waves to protect the internal ear. Below this canal, we can see one more tubular structure. This tubular structure is known as the pharyngotympanic tube because it connects the nasopharynx to the tympanum or middle ear cavity. So name for this is pharyngotympanic tympanic or tube or the auditory tube, and it is having a special name, unique name, Eustachian tube. This tube maintains the pressure equal to atmospheric pressure in the middle ear, and it equals the pressure of the nasopharynx to the middle ear cavity. Sometimes there is a blockage in this tube, especially during upper respiratory tract infection, which can be relieved by some decongestant medicines. So this tube is playing a key role during some clinical conditions like the upper respiratory tract infection and some other infections of the middle ear cavity. Below this tube, the anterior wall is related to an artery. The lowermost part is related to an artery. This artery is known as the internal carotid artery. It is also having a plexus or net of the tiny neurons known as the sympathetic neurons. These neurons are postganglionic neurons taking origin from the cervical ganglia and innervating the head and neck regions and also the brain region, the vasomotor, and it is also innervating the mucosa of the middle ear through two arteries which are piercing the anterior wall the one artery only. There are two nerves and one artery. This is the tympanic branch of the internal carotid artery and two nerves which are branches of this network of the sympathetic nerves. It is having superior and inferior carotico-tympanic nerves. These nerves are vasomotor for the mucosa of the middle ear cavity. So these are the superior and inferior carotico-tympanic. The names in anatomy are not difficult to remember. It is very simple. Coming from carotid and going to tympanum. So it is carotico-tympanic nerves, the superior and inferior. So this part, which is formed by a thin plate, and this wall is forming the posterior wall of the carotid canal and forming the anterior wall of the tympanic cavity, pierced by this carotid branch from carotid known as tympanic artery and two branches from the surrounding postganglionic sympathetic fibers which are entering in the tympanic cavity through the small openings and innervating the mucosa of the middle ear cavity. So this is the anterior wall. Up to now we have seen the mastoid or posterior wall, the anterior or carotid wall, the tegmental or the roof, and the floor or the jugular wall. Now after a short break I will talk about a little complicated medial and the lateral walls. The medial wall is little bit more complicated in comparison to the lateral wall, which is having the promontory and some other openings and depressions which are produced by the inner ear.